My name is Lucas Koberda, and I'm a neurologist who is involved in neurofeedback, actually a specific type of neurofeedback called this called Loretta neurofeedback. Before I will explain a little bit details what we are doing with neurofeedback, I would like to first say how did I get involved. Several years ago, I was actually the consultant for one of the largest psychiatric forensic hospitals in New York. And I noticed that some psychiatrists were using the QEEG brain maps for behavioral analysis of forensic patients. So I was intrigued by that, and I started reading up and seeing how that could be incorporated into neurology as well. Subsequently, I moved to New York to Tallahassee from New York, and there was a group of very good neurologists, and most of the patients who were coming to visit me, they already seen all of them, and they presented with the problems which were resistant to conventional therapy. And I was in big despair because I did not want to initiate the therapy with the same medications what were already tried and gave side effects or did not help. So I started really exploring new modalities of therapy which would be helpful for those patients who are resistant to conventional medical therapy. And that's where I started with neurofeedback. Actually, I had two psychologists who I knew in Tallahassee who were doing single electrode neurofeedback, very simple, which started almost 40 years ago. And some of the patients that I referred to them, they got better. So I became interested in the technology, and I, of course, since I've been in research for many years in academic positions, that's how I came to this country. I'm originally from Poland, but I was invited as a postdoctoral fellow to work for University of Texas MD Anderson Cancer Center for 4 years, that was almost 25 years ago. So I did research, and I have a research background. So I started analyzing which system would be the best, and I concluded that this called Loretta neurofeedback, which trains whole brain using a CAP system with 19 electrodes, active electrodes, and can give electrical dysregulation analysis of the brain in three-dimensional level was the best way to do and start. So I started enrolling those patients who were interested and who had no other options left, including patients with depression who went through electroconvulsive therapy, shock therapy, and other patients who did not respond to multiple medications. I collected close to 220 patients at this moment, and I'm at the point that I can analyze subgroups using patients with one diagnosis, depression, anxiety, or headaches, or epilepsy. And on average, I would say there is close to 70% response rate with 10 sessions. We do sessions usually once or twice a week. So within 5 to 10 weeks, we can have significant improvement of the patients, both subjective when the patient reports improvement and objective when we see improvement on QEEGs, which were done before and after neurofeedback, where we see improvement in the pattern. We also do cognitive testing, computerized cognitive testing, which we do before and after neurofeedback, and they also serve as objective improvement if they have improvement in the cognition.
Focusing on epilepsy now, that one patient that came to you from California, if you could just recount that. Okay,
so with epilepsy patients, we have now more than 10 epilepsy patients which are refractory to medications. So we have a patient coming from all over the country, and lately we had a patient who came from Los Angeles. A patient was evaluated at UCLA by neurologists, placed on medication which gave actually worsening of the seizure frequency. Subsequently, patient was treated with Dr. Barry Sterman, who is famous for his approach with epilepsy protocol. And patient completed 90 to 100 sessions with partial improvement of the seizure frequency, but still relatively frequent seizures were occurring. So they traveled to me and they stay for a week in Tallahassee, where is my office. And they had actually the neurofeedback delivered twice a day, morning and afternoon. Morning was auditory biofeedback when the patient listens to the music, and the music only plays when those abnormal brainwaves, in case of epilepsy, usually they are slow waves, disappear. And the same is with video and combined auditory biofeedback when there is a video which freezes in case of those abnormal brainwaves are still occurring. So after 1 week of therapy, this patient significantly improved and reported 5 to 6 months seizure remission. Patient subsequently started having continuation of the same protocol therapy in California, since other providers are learning how to do that. And she had 1 breakthrough seizures which require, after 5 months, I believe, which requires some additional therapy after that.
If I'm remembering the story correctly, when she came to see you, she was having maybe 2 seizures per month?
Yes, a few seizures a month, frequently in the morning after awakening. And after that, she had no seizures. Also, what is interesting that she complained of the cognitive problems. And we did cognitive testing, and she was low on most of the testing, and she improved subjectively very much. She's high schooler applying for college, so having good grades in school is very important for her.
This is good, Dr. Koberda. You're a curious man, motivated to help desperate patients. You've picked up on new ideas and put together an approach that gets results above and beyond the current standard of care. So, how do we pass your understanding, motivation, and hopefully your curiosity on to the next generation of medical doctors?
Well, I have actually 4 to 5 students, undergrad students, 1 grad student, who are in my office. They are Florida State University students, and I'm also adjunct faculty, so the students, medical students, are, if interested, able to rotate with me and be exposed to neurofeedback. I think the young population is very open to the new technologies. The therapy is based on computers and sophisticated programs, so young people pick up that very easily. And I think they have a lot of enthusiasm when they initiate neurofeedback therapy. Some of them, they complete the projects and they write like a special thesis which is evaluated by the professors at university, and all of them, they got very good grades. So I think that inspires the other students as well, and hopefully we'll have more students who will be interested in learning about neurofeedback as well.
Perfect.